There is no any healthcare system that will succeed without provision of quality and available drugs and facilities.
The Director General, Drugs and Medical Consumables Supply Agency, Pharmacist Gali Sule, explains why the state government prioritizes qualitative drugs and the mandate of its agency.
The agency was established by the Kano State House of Assembly Law of 2009 with the sole mandate of sourcing and providing drugs to Kano State-owned public healthcare facilities. These drugs and medical consumables are supposed to be qualitative, affordable, and available at all times. So this is the sole mandate of this agency. Sourcing of these drugs and medical consumables is from two perspectives. We are sourcing from manufacturers and importers, and also we have drug manufacturing unit within the agency which we use to manufacture some drugs, particularly oral liquid preparations. So this is the mandate of the agency that was established by the law of Kano State House of Assembly. We have about 900 healthcare facilities that are sourcing their drugs from the agency. So we embarked on a procurement process that will ensure affordability and availability of drugs to this teeming populace with Kano State.
Alhaji Gali further explains the importance of drugs in the healthcare delivery system.
Drugs are important components of healthcare delivery. In fact, drugs are at the hem of affairs. There is no any healthcare system that will succeed without provision of quality and available drugs and facilities. If a patient goes to a facility for a medical treatment, he will be consulted by a doctor. He may be asked to perform some basic tests in laboratory or other investigation units of the facility. So at the end, drugs will be prescribed for that patient. If he is unable to get the drugs, whatever was conducted will be in vain. So the roles of drugs in a healthcare system is paramount. Without drugs, like I said, there is no healthcare services delivery, because you will never succeed in whatever you are doing. So the roles of drugs and any healthcare delivery cannot be overemphasized.
On his path, the Director of Drugs and Supply, Pharmacist Tukur Ibrahim, explains the various mechanisms put in place by the state government to ensure the smooth conduct of the program.
The state has committees, about 5 levels of committees. We call those a governing structure for the programs. The first level is the Sustainable Health Commodity Supply System Steering Committee, which is being chaired by the Honorable Commissioner for Health and all other head of agencies. This agency inclusive HMB, primary health care, and all agencies under the health sector. The head of such agencies are members of that committee. And then the Director of Pharmaceutical Services, Ministry of Health, is the secretary of that committee. So this is like a policy body making committee, and any decision that needs to be taken, then that committee will take. And under them, we have the State Sustainable Health Community Supply System, which is chaired by the DPS, Ministry of Health, and then other relevant directors across the health MDS are members, including some civil society organization, and then community representatives are also members of such committee. So this committee has a lot of roles and responsibility, of which one of them is to ensure that the way this program is designed is being implemented across level. We at the agency inclusive, and then all our tertiary, secondary, and primary care facility all inclusive. So under this committee, we have what we call the in-state team. These are young and vibrant healthcare professionals. Some of them are doctors, some are pharmacists, some are nurses, some are CHO, some are accountants. So we selected them deliberately across facilities within the 44 local government, and they form the in-state team. So they are the technical arm of this committee, and they are like the foot soldiers of the committee. So they move around facilities, and then whatever issues they found, then they quickly report to the main committee. Things that they can take action, they will take action there and then. While things that is beyond them, they will report to the state committee. And the state committee will now send more delegates to go and verify and then establish the fact and then took action. And if such offenses or issues are more than the committee, then they will pass it to the steering committee, and then the steering committee will take the final decision. And once the steering committee took the decision, nobody can reverse it, because this is the governance structure of the health sector: the commissioner, head of agencies, and then all other relevant key stakeholders within that committee.
He, however, warned that anyone caught diverting drugs from public hospitals for quick gain will not be spared.
At times, you find out there are some instances that we have a pricing policy for the program, that we here at the agency, whatever we procure from the manufacturers, we put 7.5% as markup. And then facilities across, they put 11%. And this markup has elements. It's not a profit, but rather it's for sustainability, because it includes inflation, expiry, deferral and exemption, supervision cost, and then program sustenance. So during the course of our supervision or the in-state team supervision, you find that some facilities don't abide by the state pricing policy. So is in such kind of situation, then the facility will be held responsible and then they can be punished. And sometimes, because our drugs here are relatively cheaper than outside, some facility staff, they will come and buy, and then they will divert it to the open market and go and sell to make profit. Recently, we have had that instances, and then the issue was pushed to the Honorable Commissioner for Health, and then he now put a committee that investigated, and then the case was handled to Kano State Anti-Corruption Agency, where they handled the case, and then the people were punished, and then the actions were taken. So anybody that should change the system, this kind of punishment abide.